Hey guys, Eric, your coach here. So glad to have you back for our 10th meeting on case presentation formula. And this is where we're putting it all together. So I'm very excited for you guys, and I'm proud of you that you're here and that you're doing this. You're probably going to want to watch this one multiple times over the years. It's just something that you keep going back to, and it keep resonating with you. And so I'm excited for you guys. I really want you to enjoy this one and really truly get it. So of course, I want to be hearing your challenges. I want to be hearing your successes. So if you haven't already, make sure you email me, Eric, your coach at charter.net. You have a quiz form that comes with each one of these training videos. And so I want to see those as well. Make sure that you get those to me. And of course, if you're being challenged with something that I say it's not working well for you, I'm here for you to help you out with that. Okay. So let's do our follow-ups as well. So let's go through in reverse order here. Objection formula. Keep in mind, if you're the leads on this, I want you to be paying attention to what I'm saying. Objection formula, preventing cancellations in first aid, over here psychology and transfer of care, asking questions, right? Using all of your questions, whether it be implication questions, clarifying questions, answering a question with a question, leaders and trailers, getting the 3 yeses, which we're going to expand upon today. We're really going to get into that. Also, the emotional exam, finding the why. Asking for referrals, making sure that you're using your permission statement, eliminating limiting terms. Are you adapting to the patient's DISC style using Harage? And how are you doing with your new patient intake form, your GRASP form? Make sure that you have that down. Lastly, the 95-5 rule. Have you been applying that consistently? Because today we're going to take three S's, 95-5 rule, and we're going to put those two things together to create the case presentation formula. So you've already been doing some of this, hopefully. Take a moment, push the pause button, and do any follow-ups you need to, and then pick right back up. All right. So in our case presentation system, you're going to see a formula that really breaks it down and makes it really simple, expanding upon those 3 S's. We know that we can create consistent results. I have a case acceptance tracking system for you, an Excel spreadsheet. It's totally free. And what we look at is it creates follow-up and makes sure no patients fall through the cracks. What we look at is patient's name, new patient, existing patient. Then we go into patient's name, description, brief description of treatment, and then the dollar amount we presented it. If they scheduled, the date they scheduled, and then the dollar amount that they scheduled. If the last 2 are zeros, no date, no scheduling, no dollars, then there's a follow-up column that you put something in. Now, what's key about that is when my clients email me that form, I'm looking at 2 things. I'm looking at a lot of things, but especially 2 things. I'm looking at not only the number of people who are scheduling. So let's say they present to 10 people, okay? I know it'd be more than that, but keeping the number simple here. They present to 10 people. I want to see at least 8 of those people scheduling something. So we have an 80% case acceptance rate on number of people scheduling. And then the second number is the dollar amount scheduled. So out of those 10 people, we presented, $10,000 worth of dentistry. It'd be more than that, but you get the idea. $10,000. I want to look at the amount of dollars that we scheduled. So on our dollars accepted, I want to see at least 60% of the dollars being scheduled. So 80% of the people, 60% of the dollars. And then for those that are in the follow-ups, they're 20% of those people. We have action items in place with our outgoing calls, our message 1, conversation 1. So if you don't have that and you want that, email me, Eric, your coach at charter.net. I'm happy to send that to you at no charge. And then we can even do training on it for you if you'd like. All right, sound good? Let's get started in our system here. So we already know this. Success comes from if you're not a dentist, you don't have the diploma, you're a phony. So you got to have your foundation, your technical expertise. This comes from Carnegie, your soft skills. 85% of the rest of it is where your success is going to come from. Your ability to deliver on those technical skills is going to come out of this formula right here, this verbal skill. So what are we going to cover? We're going to cover this formula that we break it down into really 5 steps. So we're going to cover why it's important to the patient. We're going to talk about how concerned you are with the condition that you're uncovering and how it leads to a consequence. We're going to ask them for our 3 S's. How concerned are you with that? Would it make sense to talk about a plan? How do you feel about moving forward with this? Getting those 3 S's. So we're going to get what we call mutual agreement through this process. That's different than a close, right? A close is You see any good reason why you want to schedule this? That's a yes or no. We're looking for mutual agreement. I want them feeling like they're getting good advice from somebody they trust. We've got an open-ended response to the question, would you like to move forward? So I say, how do you feel about moving forward with this? So we'll talk about that some more. All right, let's look at why we're doing this. Number one reason is people buy for their reasons, not your reasons. So at this point, you have been using your GRASP intake form. On the back, you do your emotional exam, SWO, find their why. Why is that so important to you? We're going to be using that word important a lot. It's very important. And we're going to apply that to the case presentation formula. Second reason is, look, anytime someone's making a purchase, if they don't really feel like there's a problem associated with this, why would they spend their money? For example, this is why you get those phone calls that say, hey, I'm so glad you called me. You're calling for the courtesy call. I'm so glad you called me. As soon as I heard that, I knew bad news was coming. They say, yeah, that tooth's not even bother me. So I'm going to go ahead and cancel my appointment. You guys know what they say. The reason they say that is because of this right here. They don't believe there's a problem. The reason they don't believe there's a problem is because there's no pain. And when there's no pain, right, they don't perceive there's no problem. And therefore, no pay. No pain, no problem, no pay. You need to understand that so that you can circumvent this and attack it before that objection ever happens. That's not even an objection. That's a cancellation. So we prevent that by using these two systems here. Let's talk about how the old ways, the dump truck dentistry. I got to tell you a story. So I was actually sitting down in a consultation, observing a consultation presentation, photos on the screen of the patient, just didn't look good. The patient even said, wow, that's hard to look at. And how the dentist proceeded was, what I could do is I could put crowns on all these teeth right here. We could really even out your bite. It would look really, really nice. The next question from the patient was, as you guess it, what is it? What's the question? What's the question the patient asked right away when they hear crowns on all these teeth? What do they think of? How much is that going to be? The cost. How much is that going to cost? He said, well, 8 teeth, $8,000 to $10,000. Patient sits there and thinks for a moment, and I'm looking at the patient. Patient's thinking, they're not bothering me. I could get by. I'm 70 years old. I think I'll wait. Do I have to do that? And the doctor said, I just want what you want. And so they went ahead and did a partial on the upper left. So look, guys, I'm going to change that whole scenario. I'm going to use that example, and we're going to rewrite that. That just happened recently in an observation of mine. Now, I said we're going to expand upon the 95-5 rule. So how this works is I've moved this line over so you can see how much more time I want spent proportionally on conditions and consequences versus treatment. When I'm in conditions, I'm letting the patient know what that problem is, that reason number 2, what that problem is, why I'm concerned about it, and what's going to happen if nothing is done about it. So the good news is we only have to have 2, sometimes 3 consequences to worry about. So for example, what example of a condition could we use? You tell me. Usually I hear decay and gum disease first, right? Okay, so let's start with decay. Decay is a condition. What is the consequence of doing nothing about that decay? You tell me. Now, sometimes I hear people shout out, root canal, root canal. That's a treatment. That's not a consequence. That would happen if you do nothing. That's a treatment. But with the root canal, you are treating the consequence, which is toothache. So consequence number 1, toothache. Let's take condition number 2, gum disease. What is the consequence of gum disease? What is it? Sometimes I hear extraction. That is, again, a treatment. It would be tooth loss. So toothache or tooth loss are the only 2 consequences we're going to worry about here, and they fall under this conditions category. And this line is really important. In fact, you could write down 95/5 and look at that for a moment. Write it down. And when you look at that 95/5, what is the most important thing you're writing down? What are you looking at there? 95/5. What stands out to you the most? Hopefully, it's the slash in between the 5s. Because that barrier is this line right here saying, hey, you are not allowed to talk about the 5%, the treatment, until you're sure the patient believes there's a problem, right? Number two, people don't buy a solution to a problem they don't perceive to have. Well, how do you know if they want to buy the solution? You got to ask them, do you believe this is a big enough problem that you'd want to take care of it? This is where our three S's came into play. How concerned are you with the decay? Now, we're going to expand upon it, okay? So let's look at how we do this. Remembering, do not cross that line and talk about treatment until we get two yeses, till the patient says so. Do not cross that line, okay? All right, here's the formula. Now, I wrote this in 2008 in a mastermind group. We talked about how can we make this simple for the team, treatment coordinator, office administrator, managers, assistants, hygienists, doctors. How can we make it easy for them to present what's happening here to the patient in a way that the brain actually works? Okay. Now, obviously, if the patient says, wow, I didn't realize it was so bad, what do I got to do to fix it? We're in and we can present. We're in the 5%. Most of the time, that doesn't happen, and we need to get to that place. So here's what you're going to do. You can write this formula down if you don't already have it in front of you. And if you're looking at your notes, your handout, you've got this broken down, and we use the words. We say, all right, the first step is why. In quotes, the word is important. And where does that come from? That comes from the emotional exam that you did preclinical before, and you said, why is that so important to you? They wanted to look good and feel good. Why is that so important to you? Peace of mind. I don't want to lose my teeth like my grandfather did. I've got a job promotion coming up. I'm in front of people a lot. So we would put this in this spot right here. I'll break that down for you. How that sounds is, so I always lead with the word important. So I say, Ricky Bobby, earlier you shared with me that it was really important for you to have a nice, beautiful smile for all of your commercials you do for your sponsors. Okay, sound just like that. People buy for their reasons, not your reasons. People don't buy a solution to a problem they don't perceive to have. We're putting both of these together to solve the equation, okay? So people buy for their reasons, not your reasons first. Otherwise, it's because I said so. And remember, our parents said that to us, and we vowed we would never say that to our kids. So because I said so. So if you go to my example, I was talking about the presentation, instead of just putting some pictures up and saying I could do crowns and make this look really nice, the lead would be, Marky Mark, earlier you had shared with us that it was really important for you to have a healthy, strong smile that you could feel confident that was going to last you the rest of your life. You have diabetes that you're concerned about, total body health, and so I took that into consideration as I look at your mouth. I look at everything. Okay, push the pause button. I'm leading with a reason why he said he was even there to begin with, Marky Mark. Okay. Step number 2 here, conditions. You can look in your handout. You can see that in conditions, we always use the word what? I am concerned. So if you don't have that, write it down, concerned. I know you said it's important to you to have peace of mind. I am concerned about the structural integrity of these teeth. You can see the fractures running right vertically through these teeth on this picture right here. You can see how collapsed your bite is and how heavy you're hitting in the wrong location of these teeth. That could fracture these teeth. Step number 3, consequences. We always use the phrase leads to. Your primary concern was 3 missing teeth in the upper left from the old bridge that's no longer there anymore. There's no way to put an implant in there anymore. The bone has disappeared, melted away without being used for all these years. And so how do we do this? Well, the reason I'm so concerned about these other teeth, if they break and you lose those teeth, now you've got more teeth to replace. I know you don't want to have those gaps anymore. That's why I'm so concerned about all of this coming together for you. All right. So I've really painted a picture for the patient. Hasn't taken very long. And now test the buy-in, the first of our 3 yeses. And I've given this to you. Okay. It's always worded the same exact way. How concerned are you with that? So in this scenario, if I put it all together, I say, Marky Mark, I know it's really important for you to have that peace of mind, filling in the space in the back, not having a gap there, being able to eat and function, making sure that total body health was all in line. having that in mind, as we did the exam, I'm concerned about the structural integrity of all of your other teeth. As you can see in these pictures, the fractures that are running through them cause me for concern, because what that leads to is those teeth breaking and they're at risk for tooth loss. And now you've got more missing teeth, inability to eat and function, more complicated situation with your bite, and now you're not able to eat healthy things that you need to eat to take care of your whole body. How concerned are you with stopping that from happening? Of course, they're going to say, yeah, I'm really concerned about it. Yeah, I'm concerned about it. They'll say something, and from the tone of their voice, you'll know to what level they are concerned. Okay? Now, that's my first yes. I'm still in the 95%. I'm still in that realm. I haven't talked about treatment yet. Then I ask the patient, I say, would it make sense then for us to talk about a plan, come up with a plan together on how we can stop this from getting worse? Yes. Yes, number 2. Okay. I didn't say treatment plan, because when a patient hears the phrase treatment plan, what do they think of right away? That's right, money. How much is it going to cost? So I say, would it make sense for us to come up with a plan together on how we can stop this from progressing, getting worse? And I'm nodding my head, and they say yes. That 95/5, that bar, that line in between the fives has now been removed, and I can move into the 5% where you're comfortable talking about treatment, right? And now you can start talking about crowns, fixing the bite, getting things lined up. At the end of talking about the 5%, I'm looking for my third yes. Now, you could say, how does this sound to you? Good. Does that mean they're moving forward? No, it sounds good. Doesn't mean they're moving forward. You could say, how soon would you like to get started with this plan? Real close. And I'd be okay with that. But it may sound forced or may have sales pressure applied to it. Would you like to get started this week or next week? An assumptive either or question close. You've really been to your sales class, right? You're asking. That's fine. I'm okay with it. Would it make sense for us to move forward with this plan? Yes. That's pretty good. That's a pretty good close. Would it make sense? I'd probably use that with a C. Makes sense. C's like to make sense. However, it's a yes or no question. You've heard probably this one. Do you see any good reason why you wouldn't want to move forward with this plan? No, which is actually a yes. Again, a good close. However, it's yes or no. My preference, how I love to say it, is the word feel. It's an IS thing. That's probably why I like it. My I dominates. And so I say, how do you feel about moving forward with this plan? Now think about how I asked that question. How do you feel about moving forward with this plan? Is it a yes or no question? No, they can't go, yeah. They might go, well, it sounds good. They'd have to say more than just yes. I get a sense from their tone of voice. Were they really in, or were they just yesing me? Okay. How do you feel about moving forward with this plan? Well, I don't know. How much is it going to be? A lot of hesitation in tone, that sort of thing. If that happens, we just go back to your objection formula. Hey, I get it. We got to be careful on how you budget your finances. If we can figure out how to financially make this work for you, forget about that for just a second and just focusing on the plan. Is this the type of plan that you see yourself doing that gives you exactly what you're looking for to keep your mouth healthy and have that longevity you want, that peace of mind you want for total body health? The plan-wise, is that good? Yes. So it's really just worrying about the financial part of it. Am I right? Yes. If we can get the financial part worked out, how do you feel about moving forward with this plan? That would be great. If we could figure out the financial part, that would be great. Now you've got a real yes. That, to me, I'm really paying attention to, guys. Look, the bottom here, it says, don't violate the trust curve. And that trust curve that Ted Morgan, one of my mentors, talked about, wrote an article in Dental Economics about, and taught this to me back in 2008, 9. Look, that trust curve is built upon the graph. Now, if you love graphs, you think graphs are sexy, you're going to love this part. So prepare yourself. So you have trust vertically, and you have time relationship horizontally, and you've got this curve that comes out. And the more time and relationship you build, hopefully that trust is going up. If you've got it going down, you got messy essence, and don't have good self-awareness, and you're not able to build rapport with people. So we want to see that trust curve go up. Now, some people that are referred, they don't come at 0. They come in at a higher, quicker peak. Keep in mind, we're scheduling an hour, hour and a half, 2 hours with a new patient. At the end of that time, we're asking them to marry us. We're asking for a commitment of $3,000, $10,000, $40,000. We just met them. And so you better make sure that that trust curve, you're not violating it, right? And pushing too much. Do you see any good reason why you wouldn't want to get in this car today? What's it going to take for us to get you in this car today? Those are question closes. And if it comes off that way and you don't have mutual agreement, like it says here, you're going to violate that trust curve. It's going to be a no, and you're dead in the water. So again, how do you feel about moving forward with this plan? You're really testing where you are in that trust curve. Maybe it's out of the $10,000 plan, they're ready to move forward with one thing. It's not ideal, but they're ready for something. Now, that brings up a whole other can of worms that we need to talk about, which is how do you get the whole case in financial arrangement so that they're not doing once a year for 12 months, no interest, or two, waiting for my insurance to renew. That's a whole other conversation that we need to have. And if we're not in a relationship, you should email me. We could talk about it, because we should be setting up financial arrangements for the whole plan to be paid out for 4 or 5 years, not to do one or two things every year for 4 or 5 years, because by the time you get to year 5, that tooth that you diagnosed is probably blown up, destroyed, toothache, root canal, and the cost is great. And when a patient says, well, I don't want to pay interest for 4 or 5 years, I said, well, the interest you would pay on this plan is a lot less than the root canal cost that you'd pay in 4 or 5 years on these teeth. So work on that, understand that concept. And if you don't, let's talk. So here's what you're going to do. You're going to put this together and you're going to practice this. I'm going to leave this up on the screen for you to practice. You're going to use the same exact scenario I'm using. So I'm going to set it up for you. We're going to take care of Betty White. She's our patient today. Her why was, it was really important for her to have peace of mind and not lose her teeth like her mother did. Her condition we found was gum disease and decay under old crowns. Okay, decay under old crowns, defective margins, soft under there. The consequences, tooth loss, toothache and tooth loss. We're going to use those. We're going to test the biomutual agreement. So how that sounds is, I'm just going to, of course, do my part. So I'd say, Betty, earlier you shared with me that it was really important for you to have peace of mind, knowing that you weren't going to end up in the same category as your mother did with losing her teeth. And so taking that into consideration during the exam, I wanted to uncover anything that might affect you being able to achieve that goal. And so as you heard during the exam, there were 2 big concerns that are affecting that. Number one is the active infection, gum disease, that's going on right now beneath the surface in your gums. And it's in an area where you can't clean. It's not your fault. That's why we're here. We've got to take care of that for you. The reason I'm so concerned about that is because what it leads to, and that is that the gum tissue receding and melting away, and you got really long teeth with black spaces. You've seen that before. That's creates mobility, and the tooth is loose, and it has to be removed. How concerned are you with stopping that from happening? Okay, you're concerned about it. Great. The second thing I'm concerned about is the active decay that's going on the actual tooth surface underneath those crowns. It's like they've creeped up underneath there, and they've actually started to wreak havoc in an area where you can't even brush your teeth, in between the crown and the actual tooth. It's similar to a puzzle. You like puzzles, Betty. Putting a puzzle together, right? You've done puzzles before, and you put the puzzle piece in, and you put it in over and over again and over again. You take it out, you wiggle it, and maybe you put the wrong one in the wrong spot, and you try to force it. And eventually it gets to where the picture of the puzzle wears away, and you see the brown cardboard underneath, right? That's what's happened to your crown. And so now there's a gap in between the puzzle pieces, the crown and the tooth, and that's a Grand Canyon for tooth decay to get underneath there. That's a concern because that decay is heading south, straight for the nerve of the tooth. And do you know, Betty, what happens once the decay hits the nerve of the tooth? A toothache. Have you ever had to have a root canal before? No. Have you heard about them? Yes. The other thing is, if it's unsavable at that point, it can cause you to have the tooth removed as well. So how concerned are you with stopping this active decay from wreaking further havoc on those teeth? You're concerned about it. Okay, so the gum disease and the active decay. Would it make sense then for us to come up with a plan together on how we can stop that from happening? Yes. Okay, here's what we would do. scaling root planing, crowns, whatever that is. Maybe sidebar plan for implants just in case, whatever that might be. Okay. I get done with presenting the 5% and I say, Betty, how do you feel about moving forward with this plan? If there's hesitation, engage in your objection formula conversation. Back up. We'll talk next month about word pictures and belief windows, which I just used with the puzzle piece. We'll talk about that next month, next meeting. And you can understand where this patient is. You have the skill set now to address where that lack of urgency is. If she says, no, I'm ready. I just need to figure out, can I afford it? Awesome. Let's go up front and see Rebecca, the receptionist, and she's going to go over all of that with you. How do you feel about that? All right. All right. Awesome. So you're going to push the pause button. You're going to practice the same exact scenario I did. Get a partner. The person with the shortest hair is the patient first. The person with the longest hair is the dental team member first, and then flip-flop. Push the pause button and come back to me. Go for it. All right. How'd you guys do? All right. Hopefully, you're getting mutual agreement and you're not closing cases, right? You'll get better and better at it. You've got to practice this. Look, guys, watching me do this or watching this, looking at this on a screen and thinking, okay, I'm going to go do that. It would be like me watching, TV, watching a professional sports team, basketball. I love basketball. Watching a sports team dribble around, do some fancy move, dunk it, and then me go out, to a game here, go to a pickup game or whatever, and expect me to be able to just do that. No, in between those two moments, the watch and the action, I've got to practice. And if you don't practice, you will never have that level of action application that you want, right? In the very, very beginning, we talk about coaching and practicing this and going through your funnel and breaking things down. Right now, you're assessing yourself and saying, am I in alignment with what Eric's talking about? If not, what's my action I'm going to take and how do I create accountability to that, right? Assess, alignment, action, accountability. So make sure that if you didn't do this perfectly, which, okay, I'd rather you try to perfect it here than try to perfect it on the court in front of the patient. All right, let's move along here. I want you to create your leader. Who's your leader? You know what your action plan is. You know that it's this formula, right? It's getting to mutual agreement. 3 S's, getting to mutual agreement. Who's your leader? So pause this for a moment and figure out who's going to lead us. Probably 2 people, probably an admin and a clinical. Could be anyone. Go for it. Pause. All right, you got your leaders. Now they're going to create the accountability to making sure we do this. All right. Excellent. So here's an overview of what we covered today, why it's important to the patient, why they should be concerned, right? What it leads to, even bigger deal. And then 3 S's. How concerned? Would it make sense to come up with a plan together? How do you feel about moving forward with this? Get 3 S's. You guys got it? Awesome. Next meeting, we're going to get into belief windows and word pictures, just like I did with the puzzle piece. So we'll talk about the difference between the two. We'll talk about how to make sure we describe those conditions to really, that's what I was doing, the defective margins, using the puzzle piece example. I was using a word picture, okay? And then we could even describe the treatment if they want to get into in that 5% window, how you use belief windows and word pictures, describe that to put their mind at ease, okay? And we'll create a library of belief windows and word pictures. All right, you guys. Awesome. You guys are the best. Keep in touch with me. Please let me know how you're doing and how I can help you. I love to hear success stories. Eric, your coach at charter.net. If you guys aren't already, make sure you follow me on social media, Vickery Coaching. Look that up. Go to my website, Vickery Dental Consulting, and you can click on all the links to follow. I'm putting out free content all the time there for you guys to sharpen the saw, okay? Thank you guys so much. Have a great rest of your day.